Welcome friends, I am Dr. V.K. Chauhan, homeopathic physician. We are revising homeopathic remedy Cactus grandiflorus, and this part 5 deals with Ellen's PQR review with guiding symptoms of our materia medica, and this is good for 4th BHMS students and interns. So friends, before we go to the text, let us have some information. Dr. Contestine Herring has been engaged to write a book confuting homeopathy, but upon reading Samuel Hahnemann's works and investigating homeopathy's clinical claims for himself, he became convinced of its efficacy. Later, Herring was treated for a dissecting wound with the homeopathic remedy arsenic album, and the finger was saved, further provoking his interest. Guiding Symptoms of Our Materia Medica is a monumental work of 10 volumes by Dr. Contestine Herring. To facilitate the study of relative value of symptoms, 4 marks of distinction have been adopted: thick vertical 1 line, thick vertical 2 lines, and thin vertical 1 line and thin vertical 2 lines correspond to the 4 degrees in the Boning-Hassan's repertory. It is a collection of cured symptoms, and hence it is a complement to all other works in our materia medica. Symptoms of each drug are grouped under 48 headings, and hence the search for the particular symptom is easier. Ellen's keynote book is entirely based on Herring's guiding symptoms. For each drug, Ellen selected some symptoms from guiding symptoms according to his sense of priority and his own personal experience. So these are the 48 sections which we are going to have the symptoms, and there are certain chapters which are only having the red, in red the headings. They indicate they only have the first grade symptoms. We'll take up the PQR 1 from Ellen's keynote: sanguinous congestion in person of plethoric habit, often resulting in hemorrhage, sanguinous apoplexy. So this information has come from Stage of Life and Constitution, section 47, from Guiding Symptoms of Our Materia Medica, and this is the first grade representation there: sanguinous congestion in person of plethoric habit. And from Inner Head, chapter 3 or section 3, we find sanguinous apoplexy. Again, this is the first grade representation in Guiding Symptoms of Our Materia Medica. We go to PQR 2, fear of death, believes disease incurable. And here we find it comes from Mind section, section 1, fear of death. He believes his disease is incurable. This is a second grade representation over there. Please also see some corresponding rubrics could be there. During and after attack, great anxiety, fearing some organic lesion of heart which will cause sudden death. This was given in angina pectoris. Early frightened, often awakes in a fright. Enlargement of the heart, second grade representation. So what are the symptoms we see in guiding symptom of our materia medica, and in what condition they have been used? Both the things are there here. We go to PQR 3, hemorrhage from nose, lungs, stomach, rectum, bladder. So this is the diathesis part, and it comes from the tissue, section 44. Hemorrhages from nose, lungs, rectum and stomach, second grade representation we find. PQR 4, headache pressing like heavy weight on vertex, worse during climacteric, and we have similar remedies, gluonine and lacasis. So we couldn't find any corresponding rubric or symptom in guiding symptoms of Habermatia medica. However, in inner head we find section 3, pain in right temple by spells brought on by a glass of wine, attending opera, or after getting dinner too late an hour. Heavy pain like weight on vertex, better by pressure but worse from sounds, hearing, talking, or slight strong light. Right-sided headache and neuralgias, which are periodic, pulsating and throbbing and of an extreme type. This is again a first grade representation here. Friends, PQR 5 tells us about headache and neuralgia, congestive, periodic, right-sided, severe throbbing, pulsating pain. Inner head, we find first grade representation, right-sided headache and neuralgias, which are periodic, pulsating and throbbing and of extreme type. Pulsating pain which with sensation of weight in right side of head, continuing day and night, so severe as to make him cry out. It is a second grade representation. And again second grade representation, we have heavy pulsating pain in head. Let us go to PQR 6. Whole body feels as if caged, each wire being twisted tighter and tighter. This is sensation, chapter 43. Whole body feels as if caged, each wire being twisted tighter and tighter. This is a fourth grade representation in guiding symptoms of our materia medica. PQR 7 tells us about constriction of throat, chest, heart, bladder, rectum, uterus, vagina, often caused or brought on by the slightest contact. We have corresponding section 43 sensations, and we find here constriction of chest, heart, bladder, rectum, uterus, vagina, etc. is frequently brought on by slightest contact, and this particular information is given fourth grade intensity. PQR 8 tells us about the operation of chest as from a great weight, as if iron band prevented normal motion. So we find in the respiratory section 26, operation of chest as from great weight, difficulty breathing, uneasiness as if iron band prevented normal motion of chest. First grade representation we have here. Please also see operation of breathing on going upstairs in case of bronchitis. Second grade representation we have. Chronic operation of breathing, again second grade representation. Feeling of operation during respiration, palpitation of heart during, we have second grade representation. Operation of chest like a great weight, or as if chest was compressed with fainting, cold sweat, loss of pulse. This is a second grade representation in terms of intensity. Now we go to PQR 9, sensation of a cord tightly tied around lower part of chest, making attachments of diaphragm. So here we find this information under hypochondria, section 18. Feeling as of a cord tightly tied around lower part of chest, making out attachments of diaphragm, especially in case of rheumatism of diaphragm. It is a first grade remedy representation here. PQR 10 tells us about the heart feels as if clasped and unclasped rapidly by an iron hand, as if bound, had no room to beat. And we'll see the chapter or section 29, heart, pulse and circulation. Sensation of constriction in chest, in heart, as if an iron hand prevented its normal movement. First grade remedy representation. Constant pain in the region of heart with sensation as if heart was bound down or had not room enough to beat, or as if bolts were holding it. Sequelae to rheumatism. This is a first grade remedy representation here. Feeling as if heart was compressed or squeezed by a hand is again a first grade remedy representation here. Heart seemed to be held by an iron hand for many hours. In case of angina pectoris, cardiac rheumatism or fatty degeneration and hypertrophy. First grade remedy representation what we see in guiding symptoms of our materia medica. PQR 11, pain everywhere, darting, springing like chain lightning and ending with a sharp, vise-like grip, only to be again renewed. We go to sensation, chapter 43 or section 43, pains everywhere, head, arms, legs, back, chest, heart, darting, springing like chain lightning, terminating with a sharp, vise-like grip, only to be commenced again a moment afterwards. This is a fourth grade remedy representation in guiding symptoms of our materia medica. We find PQR 12 now, menstrual flow ceases when lying down. Female sexual organs is the chapter where we will find this information. Menstruation with constrictive spasm of uterus, pains, agonizing, worse evening, flow scanty, ceases when lying down. Menses ceases at night. This is a second grade remedy representation here, and third grade, especially if you see menses ceasing at night. We go to PQR 13, palpitation, day and night, worse when walking and lying on the left side at approach of menses. So friends, let us see. Heart, pulse and circulation is the section 29. Information we have: palpitation of heart, continued day and night, worse when walking, at night when lying on the left side. It is a first grade remedy reference here. Also we can see palpitation of long standing caused by an unfortunate love affair. Second grade remedy representation we have. Violent palpitation with suffocative spells when lying down, especially fatty hypertrophy of heart, a second grade remedy representation what we see here. PQR 14 tells us about the fever paroxysm returns at 11 am and 11 pm. We go to the fever section, chapter 40. Chill not relieved by covering, returns same time or same hour each day. Regular paroxysm at 11 am and 11 pm. A second grade remedy representation here we see. Friends, thank you very much for your patient listening.